macular structural abnormalities in patients with metamorphopsia after rhegmatogenous retinal detachment surgery. So metamorphopsia is a very highly
Just
prevalent
1 minute, your
symptoms.
presentation is yet to come. Wait. Please start a presentation, AV team. On that side, go to that podium, please.
Metamorphopsia is a highly prevalent symptom in 2/3 patients postoperatively, and that impairs the fusion and compromises with the binocular single vision. And there's a high risk of binocular diplopia, asthenopia, or retinal detachment. Uh, the aim was to determine the macular structural abnormalities in patients with these patients after PPV, and to identify the macular structural changes after successful PPV surgery and with help of OCT and FAF. So the study design was that of prospective, done in Arvind Eye Hospital, Coimbatore, at 18 months for 30 patients, and in patients complaining of metamorphopsia 3 months post-operatively. My inclusion criteria for the study was patients more than 18 years of age, post-RRD repair with vision better than 6/18, visual acuity, patients with no media haziness, patients with successful retinal reattachment, and post-operatively macular off, pre-operatively macular off. Medical history was taken. It was measured with the help of OCT, SD-OCT and fundus autofluorescence. Diagnosis was made based on laterality, total, subtotal macula of PVR grading, breaks, and lens status. And pars-plana vitrectomy with tamponade was done by senior experienced surgeons. Post-operatively 3 months, we took the BCVA, contrast sensitivity, Amsler grading, slit lamp examination, OCT, and fundus autofluorescence. So results were that of 80% were that of silicone oil, while left eye was 53%. Duration was ranging from 2 days to 90 days. What we saw in fundus autofluorescence was retinal vessel displacement, as you can see with the white arrows, the hypofluorescent lines showing the imprints of the previous vessel position. We saw cystoid macular edema, retinal folds, lamellar macular hole, inner segment, outer segment disruption. So in OCT findings, what we saw the most was inner segment, outer segment disruption, and that of fundus autofluorescence finding, we saw retinal vessel displacement as a maximum patients in maximum patients. On basis of the type of surgery, gas tamponade with retinal vessel imprinting, we saw similar results with gas as well as oil, while others were more with oil. And we found statistically significant difference between groups of gas tamponade and silicone oil tamponade for vitrectomy. So what we found we can see is that there was a statistically significant association with respect to retinal vessel displacement on fundus autofluorescence with type of the tamponade agent. 4 patients in our study had no macular changes on OCT, and this could be because of glial proliferation on the photoreceptor layer causing traction on the macula, which missed on the imaging modalities. And none of the studies found any duration of RRD as any significant risk factor in our study. And we compared it with the other studies that happened, and we found there were similar results seen in other studies showing that there could be development of metamorphosis due to this. And this study demonstrated that retinal vessels may move downwards post-operatively, and hence could be the main cause for post-operative metamorphism, especially with gas tamponade. And FAF was a very useful imaging modality, while it was not affected by duration of RRD and post-operative BCVA, and long-term FAF studies will be needed to demonstrate this. These are my references. Thank you so much.
Thank you.
In your study, you have assessed how you have assessed metamorphopsia only on Amsler grid test or any other objective test?
No, only Amsler. We have not done any other test. We have not done it very quantitatively. Only a qualitative measurement was done.
Was there any basically you can say subjective assessment? Some patient can tell metamorphopsia, some can overemphasize, and some can basically tell there may not be a metamorphosis.
It's a very relative.
How it was negated.
So mainly we took patients which had vision better than 6/18. So here what we wanted was to see the quality of vision rather than the quantity. And wherever patient was complaining that he's seeing some distortion of line, we were seeing Amsler's, and we could see that he could see those, we could see it on the Amsler's grid that patient is not seeing a straight line. So that is how we took. We didn't take any other investigation into account.
Different agent were used?
Yeah, we used silicone oil and gas as both.
Was there any association with?
So what we saw was with gas tamponade, we saw there were more retinal vessel displacement seen on autofluorescence. But since our sample was small, we cannot be conclusive. There was no significance found according to statistics. But other studies have shown that gas tamponade shows these significant changes. Silicone oil doesn't show that much. So we were conclusive with the fact that compared to silicone oil, gas tamponade could cause metamorphopsia more. And also other studies supported this finding, but because our sample study was small and our gas tamponade patients were lesser, we could not be conclusive about it.
Metamorphopsia, how did you actually assess? Can you tell me the procedure?
So sir, when we have seen patients 3 months post-operatively, first we saw that visual acuity is better than 6 by 18, so we have included them. Then again,
No, just metamorphopsia part.
just complaints and AMSLers.
AMSLers, how many charts?
So we did only the, we didn't do all the charts, the basic one we have done, sir.
Do you know how many charts?
9
are there?
charts.
So you have it done only on one chart?
Yes, sir.
Why?
Just we thought that if the patient is, we mainly wanted to see the quality of vision.
No,
so
no, but what's the harm in doing?
Yes, sir.
If you are doing one chart,
Yes, sir. We could. Yes.